Hi everyone, welcome to our video on 13 things to avoid if you're taking Amlodipine or Norvasc. We're going to talk about different medications, foods, and some alternative medicines that can interact with Amlodipine to either increase or decrease its effectiveness. Note that when taking Amlodipine, it is important to be aware of potential drug interactions and understand what may not be safe to combine with it. However, if you find that you need to take another medication while on Amlodipine, you should speak to your doctor or pharmacist about safe alternatives available that can help you manage your condition effectively. They may recommend alternative medications or adjust the dosage to minimize the risk of potential negative effects. It is crucial to make changes to your medication regimen with proper medical guidance. It's also important to know that every medication has side effects, and it's best to know which is appropriate for you and what to avoid when taking them. Before we start, let's talk about what Amlodipine is. Amlodipine operates as a potent member of the calcium channel blocker family, a group of medications that have a unique approach to managing hypertension. They work by inhibiting the influx of calcium ions into the smooth muscle cells of the heart and blood vessels. Calcium plays a pivotal role in the contraction of muscle cells, including those in the vascular system. When calcium enters these cells, it triggers a contraction, narrowing the blood vessels and increasing pressure. By blocking the channels through which calcium enters, Amlodipine prevents these contractions, leading to the relaxation of blood vessels. This dilation of the vessels decreases blood pressure and enhances the oxygen and blood supply to the heart muscle. It is important to note that the metabolism of Amlodipine can be influenced by other medications and substances, which we will discuss in this video now. Just a quick reminder, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns. Now, let's discuss what should be avoided if you take Amlodipine. Number 1. Simvastatin. Simvastatin, when combined with Amlodipine, presents a heightened risk for adverse reactions, notably muscle pain and weakness. This interaction is particularly concerning because it can escalate into rhabdomyolysis, a severe condition characterized by muscle breakdown leading to potential kidney damage. The concern with Simvastatin and Amlodipine together centers on the increased blood levels of Simvastatin, which is more likely when Amlodipine interferes with its metabolism. People on Amlodipine who need to manage their cholesterol levels with statins should engage in a careful dialogue with their pharmacist or doctor. They may consider prescribing a lower dose of Simvastatin or opting for an alternative statin with a lower interaction risk. Number 2. Grapefruit juice. While seemingly harmless, grapefruit juice poses an unexpected challenge for individuals taking Amlodipine. This typical breakfast beverage can disrupt the normal metabolism of Amlodipine within the body. The active compounds in grapefruit juice inhibit the action of an enzyme crucial for the breakdown of Amlodipine. As a result, this interaction can lead to an unintended increase in the levels of Amlodipine circulating in the bloodstream. The consequence of this elevation is an enhanced likelihood of experiencing adverse effects associated with Amlodipine, such as an increased sense of lightheadedness and a pronounced flushing of the skin. Individuals are advised to exercise caution to navigate this interaction. The most straightforward recommendation is to avoid consuming grapefruit juice altogether while on Amlodipine therapy. However, understanding that dietary habits and preferences vary, engaging in a discussion with a pharmacist can offer personalized guidance. This conversation can explore the potential risks and consider the timing of grapefruit juice consumption about Amlodipine dosing, aiming to minimize any negative impact. Number 3. Antifungal medications. Navigating the terrain of medication management while on Amlodipine requires attention to the potential interactions with antifungal medications. Notably, drugs like ketoconazole or itraconazole, commonly used to treat fungal infections, can pose a challenge when combined with Amlodipine. The interaction between Amlodipine and certain antifungals merits a closer look due to its severe implications on people's health and the efficacy of the treatment plans. Antifungal medications, particularly those classified as azolic antifungals, have a mechanism of action that can inadvertently elevate the levels of Amlodipine in the bloodstream. This elevation occurs because the same liver enzymes metabolize both amlodipine and certain antifungal drugs. When these antifungal medications inhibit the enzyme's activity, they slow down the breakdown of amlodipine, leading to increased concentrations in the blood. As a result, patients may experience heightened effects of amlodipine, including but not limited to an excessive reduction in blood pressure, an increased risk of edema, and potentially life-threatening cardiac events. The impact of this interaction is not only pharmacological but also clinical. Patients may present with symptoms that mirror those of excessive amlodipine exposure, such as dizziness, swelling of the limbs, or profound fatigue. These symptoms indicate the need for immediate medical evaluation and possibly an adjustment in the medication regimen. Number 4. Ginseng. Ginseng, heralded for its revitalizing effects and role in boosting the immune system, presents a notable risk when taken concurrently with amlodipine. This herb, often celebrated for its health benefits, can directly conflict with the objectives of amlodipine treatment. Ginseng's influence on the cardiovascular system may lead to an elevation in blood pressure levels, directly opposing the blood pressure lowering intentions of amlodipine. Such an elevation not only negates the therapeutic effects of the medication, but also introduces a potential risk for the worsening of cardiovascular conditions. Additionally, ginseng has been observed to modify how the body metabolizes certain drugs, potentially affecting the overall effectiveness of amlodipine. The interaction could lead to an inadequate control of hypertension or angina, putting patients at an increased risk of heart-related complications. Considering the complex dynamics between ginseng and amlodipine, individuals undergoing treatment with amlodipine are advised to exercise caution. Before incorporating ginseng or similar supplements into one's regimen, discussing it with your pharmacist or doctor is imperative. Number 5. Alcohol. While taking amlodipine, it's advisable to monitor your alcohol intake closely. Alcohol has the potential to magnify the side effects associated with amlodipine, such as dizziness and lightheadedness. These effects are particularly concerning because they can significantly impair your ability to perform daily tasks safely, such as driving or operating heavy machinery. It is, moreover, consuming alcohol while on amlodipine can lead to an increased risk of experiencing a sudden drop in blood pressure upon standing, known as orthostatic hypertension. This sudden drop can cause fainting or falls, leading to potential injuries. Additionally, alcohol itself can affect blood pressure, and when combined with amlodipine, this effect can be unpredictable. For those reasons, it's wise to avoid alcohol either altogether or consume it in moderation while under amlodipine treatment. Number 6. Diltiazem and Verapamil. When you're on amlodipine, it's essential to carefully manage your intake of other medications, particularly those within the same class of drugs. Two such medications are Diltiazem and Verapamil, which, like amlodipine, are calcium channel blockers. These medications are prescribed for similar health issues, including high blood pressure and heart-related conditions. They operate by relaxing the blood vessels to improve blood flow and reduce the workload on the heart. However, combining amlodipine with either Diltiazem or Verapamil can intensify the effects of these drugs, potentially leading to an overly pronounced decrease in blood pressure and heart rate. This heightened effect can cause symptoms ranging from dizziness and fatigue to more severe complications like hypertension or bradycardia, conditions that pose significant health risks and require immediate medical attention. The mechanism behind this interaction lies in the cumulative effect of using multiple calcium channel blockers. Since each drug inhibits calcium's role in the blood vessels and heart, taking them together can lead to an exaggerated response, resulting in the symptoms above. Additionally, Diltiazem and Verapamil can affect the metabolism of amlodipine, leading to increased levels of amlodipine in the bloodstream and further compounding its effects. Number 7. St. John's Wort. St. John's Wort, a commonly used herbal supplement for treating depression and anxiety, can have a significant interaction with amlodipine that patients should be aware of. This plant-based product induces the activity of liver enzymes responsible for the metabolism of many drugs, including amlodipine. By accelerating the breakdown of amlodipine, St. John's wort can substantially decrease the medication's blood levels and its effectiveness in controlling blood pressure or angina. This reduced efficacy can leave patients vulnerable to the conditions amlodipine is prescribed to manage. The risk of interaction doesn't just stop with diminished drug levels, it also encompasses the potential for rebound hypertension or angina symptoms due to insufficient medication action. Individuals taking amlodipine are advised to avoid using St. John's wort, or if considering it, to first consult with their pharmacist. Number 9. Licorice. Licorice is a common ingredient in various foods and supplements, known for its sweet flavor. However, those taking amlodipine should be aware of licorice's potential effects on their medication and overall health. This concern is primarily due to a compound found in licorice called glycyrrhizin, which has been shown to impact potassium levels within the body. When potassium levels drop, individuals may face an increased risk of heart rhythm problems, a concern for anyone, particularly those on amlodipine, as the medication is often prescribed to manage heart-related conditions. Furthermore, low potassium levels can undermine the effectiveness of amlodipine, complicating the management of blood pressure and angina. The interaction between licorice and amlodipine doesn't just stop with potassium. The balance of electrolytes and cardiovascular health may be affected. For these reasons, patients on amlodipine should limit or avoid the consumption of licorice in all forms, including as a flavoring in food, beverages, and herbal remedies. Number 10. Goldenseal. Goldenseal, a herb cherished for its potent antimicrobial attributes, is frequently sought after for its potential to enhance immune function and combat various infections. Despite its benefits in these contexts, Goldenseal poses particular concerns for individuals undergoing treatment with amlodipine. One of the primary reasons for caution is Goldenseal's ability to affect the metabolism of drugs, including amlodipine. Specifically, Goldenseal has been shown to inhibit the activity of certain enzymes in the liver that are responsible for the breakdown of medications. This inhibition can lead to elevated levels of amlodipine in the bloodstream, increasing the likelihood of experiencing adverse effects associated with the medication. Moreover, the interaction between Goldenseal and amlodipine may result in unpredictable fluctuations in blood pressure, making it challenging to maintain the stability essential for patients with hypertension or angina. The risk of exacerbated side effects, such as undue lowering of blood pressure, dizziness, or other related symptoms, is heightened with the concurrent use of Goldenseal and amlodipine. Given these potential risks, individuals on amlodipine therapy are advised to steer clear of Goldenseal to avoid compromising their treatment regimen. Number 11. High-fat meals. Eating high in fat can directly impact how amlodipine performs in your body. When you consume a meal rich in fat content, the absorption rate of amlodipine into your bloodstream may be delayed. This slower process means that the medication might reach its full effectiveness after some time, potentially affecting its ability to manage blood pressure levels efficiently. The interaction between high-fat foods and amlodipine doesn't just stop at absorption, it can also influence the overall health outcomes that amlodipine aims to achieve. For individuals on amlodipine therapy, it is advisable to be mindful of the fat content in their diet. Opting for meals that are lower in fat ensures that the medication is absorbed more consistently, providing a steady action against hypertension. Incorporating a diet rich in vegetables, fruits, lean proteins, and whole grains can support this goal. Such dietary choices complement the action of amlodipine and contribute to a healthier cardiovascular system. Number 12. Caffeine. Caffeine, a stimulant found in coffee, tea, chocolate, and many soft drinks and energy drinks, can significantly impact your blood pressure. For individuals on amlodipine, moderating caffeine consumption is essential to ensure the drug's effectiveness in managing hypertension is not compromised. The concern stems from caffeine's ability to temporarily increase blood pressure by causing a more forceful heart contraction and narrowing of the blood vessels. This reaction can counter the desired effects of amlodipine, which aims to relax the blood vessels for improved blood flow and lower blood pressure. While occasional, moderate caffeine intake may be acceptable for some individuals, consistent or high doses can lead to less predictable blood pressure management and may exacerbate the side effects of amlodipine, such as headaches or heart palpitations. It's advisable for those taking amlodipine to limit their caffeine intake to lower levels, typically recommended to be under 200 milligrams per day, which equates to about 1 12-ounce cup of coffee. If you find it challenging to reduce your caffeine intake, consider transitioning to lower caffeine options or decaffeinated beverages. Lastly, certain NSAIDs. Mixing amlodipine with non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, might compromise your health more than you realize. While highly effective for various conditions, these joint pain relievers and anti-inflammatory medications can counteract amlodipine's beneficial effects on blood pressure and potentially worsen kidney function. The interaction stems from NSAID's tendency to reduce the effectiveness of blood pressure medications by promoting sodium and water retention in the body, as well as constricting blood vessels. This can negate the blood pressure lowering effects of amlodipine, leading to an unintended increase in blood pressure. Moreover, this combination could be hazardous for individuals with existing kidney conditions. Amlodipine and other blood pressure medications can alter kidney function as part of their action on systemic blood pressure. When combined with NSAIDs, which also have the potential to impair kidney function through a different mechanism, specifically by reducing the blood flow to the kidneys, the risk of further kidney damage escalates. Given these significant risks, it's imperative to approach the concurrent use of amlodipine and NSAIDs with caution. You should only take these NSAIDs with explicit approval from your pharmacist, who can assess the potential risks and benefits in the context of your overall health status. For those who require an anti-inflammatory or pain relief medication while on amlodipine, alternatives that have a lesser impact on blood pressure and kidney function may be recommended. Thanks for watching. If you enjoyed this video, like, comment, subscribe, and click on the bell icon so you never miss a video. We wish you all the best for your health and well-being.